afternoon, everyone, and thank you for joining the Superior Health Quality Alliance Roundtable conversation. My name is Janae Clements, and I'm joined by my colleagues, Kim and Mike Keisha, and our guest speakers, Jenna Kellerman and Robin Stone from National Leading Age. For those of you who have been joining these meetings over the past few weeks or even past year, welcome back. And for those of you who may be new to the call, we're glad that you're here. We host this 1-hour session on the second and fourth Wednesday of the month. The first half of our session is a didactic presentation, and then the remaining half of the session will be left for a Q&A. Please remember that these sessions are for you, our audience members, so please feel free to take advantage of the chat box and ask questions or express any struggles that you may be experiencing. Just as a friendly reminder, today's PowerPoint presentation slides will be dropped within the chat in just a moment. The presentation for today will focus on the staffing crisis that many of you may be experiencing within your own facility and potential strategies to maintain retention. So Robin and Jenna, I will turn it over to you. The floor is yours.
Thank you. Welcome, everybody. This is Robin Stone. I'm the Senior VP for Research and the co-director of our Leading Age LTSS Center at UMass Boston. Just for geographic purposes, I will tell you that I'm headquartered in Washington, D.C. That is our national office. I'm currently sitting at the National Reagan Airport, waiting for a flight to Chicago, and I'm in one of the carols in one of the club rooms. So hopefully everything is going to go well. So far, I seem to have done fine. And Jenna Kellerman, when I turn it over to her, she can give a little intro about herself as well. I did happen to notice here, I looked through all the squares and it looks like we are pretty much an all-female office. So I am thinking that this is a women's power conversation today, and women as leaders and folks who really often do run these organizations around care and administration. I think the workforce crisis is clearly, obviously, very close to our hearts and our heads, and hopefully we're going to be able to put our minds together to get to some solutions. Leading Age is the National Association of Not-for-Profit Aging Services Providers across the continuum. We have members in most states across the country, running the gamut from post-acute to nursing home, assisted living, home care, home health care, adult day, affordable senior housing. We really represent the full continuum of aging, community-based aging services provided to older adults and others in communities across the country. And we all have experienced the workforce crisis, particularly over the past couple of years. But I want to let you know that our group in particular, our Leading Age, has been on top of this issue for over 20 years. Workforce crisis, if you all work in the sector for any amount of time, we know that this is not a new phenomenon. It has just become exacerbated by COVID and some other factors. So this is a systemic problem that we need to really put our heads together to try to address. And Jenna, if you can move me to the next slide. I'm going to start with just a little bit, as you can see here, intro of myself. And Jenna, you can either introduce yourself now or do you want to wait till you take over? Keep going. Okay, I'm going to keep going. We want to give you a little bit of an understanding of the context. Many of you probably understand this, but just to reinforce why this is a crisis, and then really look at tools and resources that you can use to improve recruitment and retention, and recognizing probably the biggest takeaway for us is thinking about workforce, not just as a challenge, but as an area for quality improvement and feedback. Just as you consider quality improvement for the people that you care for, thinking about a quality improvement process for the people who work for you, because the relationship between this workforce and your outcomes are very, very close. And so with that, let me move to the next slide. I wanted to give you a sense, I already talked about our membership, but our membership really does reflect the sector in general. Oops, going back to the slide previous slide, which is that we range across the full range of post-acute, community-based, everything from care coordination, hands-on care, supportive services, transportation, meals. All of these are very important services for the folks that we serve, their families as well, and the communities in general. And this workforce is critical for all of these parts of the sector. If we move to the next slide, we're going to focus primarily today on the direct care professional because this is the biggest area where we are seeing a tremendous workforce crisis. If we can go back to the slide before you. And I want to talk a little bit about one of the reasons why this is so important. First of all, these folks deliver 60 to 80% of all of the care in our sector. So they are the hands-on eyes and ears of our system, as well as the emotional support for much of our system, the personal care that is delivered in our system, a lot of the other ancillary activities that are delivered in the system. And if anyone knows the resident, the person who is getting the care, it is this frontline staff person. So we have to understand how important they are and why we need to have them, and have them not just warm bodies, but quality, trained, and supported. A couple of unique things about these folks. I think it's interesting for us to think about the fact that they work in a very integrated and intersectional environment that includes the medical, the social environment, and the physical environment. And this intersection makes their jobs extremely unique. There are very few jobs in the United States or other countries where you can say that somebody is working where people live. This is not a hospitality issue. Yes, there are some similarities to folks who work in hotels and other kinds of hospitality places, but this is actually where people live and where they are often going to die. And that makes this a very extremely complex and difficult and rewarding occupation as well. We're referring here in our frontline professionals to the certified nursing assistants, home health and home care aides, personal care attendants, dietary aides, and other folks who are really on the front line of care delivery in our system. They are mostly female, mostly low income, very high proportion are people of color, which is to say that this is very different from other parts of our sector that are mid-level managers in our C-suite, which tend to be very white. Frontline is extremely diverse. There is also a very large proportion of this workforce are immigrants. Anywhere from 25 to 30% of our workforce are immigrants. And in some places around the country, it is much higher than that. So understanding the complexity of this workforce as we think about how we create a healthy workplace and have policy and practice that is aligned with recruiting and retaining this workforce is going to be critical. So if we move to the next slide, just a couple of issues that I think we need to be thinking about is, first of all, this emerging care gap. The gap is both the fact that we are seeing a shortage now, and we are going to be seeing a shortage in the future. We're seeing just demographically that people of an age group who would most likely be in these positions are not necessarily going to be available. And we're already starting to see that trend right now post-COVID. Secondly, we're going to see a decrease in family caregiving availability because of demographic changes, including increase in childlessness among folks and other types of demographic phenomena. So those things are going to come together to really put more pressure on our organizations and you all to actually hire and retain a quality workforce. We're also seeing a significant shift from institutional to home and community-based settings, including assisted living, home care, adult day, and other types of community-based environments. And this means we're going to have a much more diverse and well-rounded and well-trained workforce to understand these various settings. Many of our organizations at Leading Age, for example, that have nursing homes also have a full continuum and are expanding their home care products significantly and need that workforce in order to accommodate the new kinds of delivery modes that they are looking into. We also are going to see a much more ethnically and racially diverse older adult population, as well as staff. Right now, about 20% of the older adult population is non-white. That's going to move to over 30% within the next 20 years. And so it's important for us, again, to think about the cultural competence issues that are tied to this trend. We also have a much more highly educated and demanding older adult population that is going to be putting a lot more pressure on our workforce, and having the understanding of how do we support this group of folks so that they can deliver their care in a professional and appropriate way, and be able to meet the demands of not the silent generation, but the new generations coming up, is an issue for all of us to deal with. If we move to the next slide. We also are seeing greater disparity between the haves and the have-nots, which I think in general is something that we all need to be paying attention to. I know that many of you have probably seen the data that suggests that nursing homes and other facilities that are more highly covered by Medicaid and that have a non-white population, resident population, do not do as well on quality and have significant staffing shortage problems. So we need to be figuring out how we deal with this disparity issue in how we deliver care, how we recruit, and how we retain quality folks, even in more vulnerable communities. We have a lot of uncertainty around the impact of new technology. You can't miss a day. A day doesn't go by that we're now talking about AI. Robots are going to be replacing everybody. Machine learning is going to move into artificial intelligence that is going to run on its own. What are the implications? What's real and what's not real? How do we really think about the role of technology and how it complements and supports our workforce as we move more towards thinking about more efficiency, and even in some places replacing human capital for technology? I think we have a lot of question marks around that. And then finally, just to hit home again, that we are just going to see an increased demand for more paid staff at a time when we're seeing significant staffing shortages and no real let up even post-COVID. So let's move to the next slide, which is why this sector is so important. And I think one of the things that we need to think about, even though we may be facing these shortages, is that this growth in the older adult population is so significant in all of our communities that these are some of the fastest growing occupations in many localities. So if we can make them good jobs, if we can recruit and retain high quality people, this is where the jobs are in the future. And this is how we are going to help to support and sustain our own communities over time. New models of care also mean that we're going to see new types of jobs in this sector, some that we have never even thought about, in terms of a lot more focus on the role of telehealth and how this workforce might be the sort of the eyes and the ears and the support system framework behind telehealth. That's just one example. The role of care navigation, following people from one setting to another. Another thing is, this is the economic driver in many communities. You all may be the only provider in a rural community and other areas where there are significant worker shortages. So this is something that is extremely critical for us to think about. And then finally, I would argue, and the data indicate that this is true, that you do not get quality without a quality workforce. I often say, it's the people, stupid. There is no magic bullet that's going to solve our quality problems. It is all about the staff who do the work. And that means this has to be numero uno on your radar screen in terms of what you invest in and how you support a healthy workplace and have trained and knowledgeable folks who are going to actually deliver good services and grow on their jobs as well. Moving to the next slide. Just the challenges to the workforce. And then I don't even need to tell you this. We know how important the pipeline is. We also know that retention challenges are just as critical. And I would argue that if you focus as much or even more on retention, you actually don't have to worry as much about the pipeline. So thinking about how you support, grow, and retain quality staff is part of your pipeline solution. And then, again, let's not think about warm bodies, even in the worst of our situations where we know we don't have people to fill our slots. Think about how we grow and support teams in our organizations that actually can do the job without having to rely on bringing in more warm bodies. And I have seen in many years of going into hundreds of nursing homes, organizations that were less well-staffed than others that did a better job and had higher quality outcomes because they knew how to work with the staff that they had, particularly understanding how to empower and support teamwork in an organization. Moving to the next slide. Post-COVID crisis is a really significant issue for us. The long-term care workforce shortages were the worst in all of healthcare, and I think this is pretty critical. You see the ACA and Cal estimates here, 60% experiencing more staffing, 87% facing moderate or high staffing shortages, and it goes on and on. 57% filling positions with temps or agency staff. This is untenable. We cannot have organizations that are filled with temp staff. It is just not there's no way to have continuity of care. There's no way to have high morale among staff. And there's no way to have good quality. We know that high usage of temporary or agency staff is related to worse outcomes. So we really need to pay attention to this part of the crisis. We move to the next slide. The reasons for this challenge at the societal level, and I'm going to quickly go through these so that we can move on to some of the solutions for you. Number one, I think that our sector is undervalued in general. It's not just the frontline professionals, it's every workplace job is undervalued. Secondly, ageism leads to a lack of attention and investment. So we are fighting that ageism every day in our work. The jobs that we do are seen as easy, default, or done after burnout in another part of the healthcare system, and that is absolutely not the case. These are highly complex jobs that require significant competencies, but they are not recognized by much of our society. Direct care worker jobs are still viewed as unskilled by many people. I still hear people call these unskilled labor. And we've done competency work at Leading Age where we understand quite honestly that these folks require significant knowledge and competencies in order to care for very frail people living with dementia, people having mental health issues, people having significant chronic care problems. This is not an unskilled labor force that we're dealing with. And finally, the vulnerable characteristics of this workforce undervalue the whole sector itself. Next slide. The reasons for the challenge at the policy level, we have inadequate public reimbursement. Many of you know that Medicaid reimbursement in particular is not adequate in many states across the country. We don't have any type of universal long-term care, long-term services and supports financing like many other countries do. And so we don't have a consistent source of financing for people who do not qualify for Medicaid. That's much of the population in this country. We have very uneven regulation. And when it does, and most of the focus in workforce has been on numbers and ratios, not as much on the quality of the staff, the training, the competencies, and the supports that are provided to the staff. There is no standardized competency-based training requirements in the United States for the staff, and a lack of workforce development to professionalize these occupations. There are many folks who want to move out of an aide position into a specialist lattice position or to grow into another job. And there's very little career advancement for this workforce. And finally, we have some serious issues around immigration policy. I will tell you that if we cut off immigration tomorrow, we would be cutting off a huge pipeline for our workforce. And this is something that you all in your organizations need to be paying close attention to, is the immigration debates that are going on in this country. Moving to the next slide. Just to hone in on the workplace level, lack of quality supervisors. I want to underscore this over and over and over again. if I did one thing in my organization to improve the workplace, it would be to ensure that all of my frontline supervisors knew how to supervise and support the frontline. Remember, these are the folks that do 60 to 80% of all the hands-on care. So they need the support, they need the education, and they need ongoing empowerment and accountability. Both of those things need to happen. And a good supervisor is the person that is going to be really setting the framework and implementing that for this frontline workforce. It's so key to your organizations. At $14.27 an hour in 2023, it's really hard to live on that. So this is a significant problem, and I know that you all can't solve that, but you at least have to understand that this is part of the challenge of recruiting and retaining a quality workforce. We don't have very good onboarding and in-service training in most of our organizations. And we do have often poor working conditions and job design. I want to go back to the notion of empowerment and teamwork. This is what we hear, that home care aides, CNAs, this is what the folks want. They want to be involved in care planning. They want to be involved in following through on care plans. I have never ever gone to a huddle in a nursing home where I have seen a CNA at the huddle. And to me, that is a travesty. I think every single huddle in a nursing home should have a CNA every single morning in those huddles. The lack of career mobility, which I said is at the policy level, but it's also at the provider level. This whole notion of inadequate compensation and benefits. And often we are not competitive technologically. The long-term care sector and nursing home in particular is way far behind other parts of the healthcare system in terms of using technology. And if you're going to be recruiting younger people into the sector, we need to be as technologically competitive as our next door neighbors. And this is something that we need to be paying attention to. So I think with that, Jenna, I'm not sure I have any more slides. Is this time for me to turn over to you? Oh, is this still me? Am I still?
You just had one last one. Yep.
Yeah, this is the last one. So this is pretty much my bully pulpit for all of you, and that is that retention is the solution to many of our recruitment problems. And I've already said this, but turnover is such a significant challenge. 50% of nursing home staff turnover annually. Look at the 55% for CNAs, 41% for LPNs, and 46% for RNs. This is untenable in our sector. And so what do we do about this high turnover? We have to actually recognize that we have to pay attention to retention. And not only is that going to stabilize our workforce, help us to produce better productivity, higher morale, and better quality outcomes, but it's also going to help us to solve some of our pipeline issues. And with that, I'm going to turn it over to Jenna.
Thanks, Robin. So I do just want to call out that there were a couple of good notes in the chat. Susan mentioned that she always has nursing assistants in huddles, so it's really great to know there are organizations right across the country that do that good work. Of course, it's someone who's a part of this QIO, so that's wonderful. One of the good reasons to be a part of these types of groups, right? And also just the comment about not a lot of career CNAs anymore. I would bet Robin has a lot of insight on career CNAs. I would argue, wages are one part that prevents that, because we don't have a livable wage, a family sustaining wage. So it's really hard to be a career CNA when your career doesn't afford you to live. I think there's also the career ladder and lattice piece that's missing from a systemic perspective. Some providers certainly have good ladders or lattices, but if we don't, as a system, have a place for them to continue to grow and learn and deepen their expertise, then it's not a very a job that's inspiring to stay in, right? So one of the concepts we often talk about is building out a career lattice for caregivers so that they can stay in that role, but still grow and deepen their expertise, which Robin kind of alluded to in her conversation. So anyway, I'll move on.
And I do want to say, I do want to add to that, Jenna. I do think that it is important for us to understand when we interview aides, and we've talked with many of them over the years. Many love their profession. They consider themselves professionals, and they actually want to stay in an aide position. The challenge is living on what they get paid, and also the fact that they may want to become a specialist within their position, dementia specialist, medication specialist, behavioral health specialist. So we need to be thinking about how we build these careers both horizontally as well as vertically. And I think, Jenna, the point that you made around the fact that if we make this point, we call these folks, these are professionals, so that if we look at these as professional occupations and figure out at least what we can do as organizations, what policy needs to do to help make this happen, I think we're going to start to move us along in that direction and have a lot more interest in working in the sector, and also a lot more stability.
Yeah, and so to build that out, we're going to move into the conversation now about practices and resources and systems to put into place to really achieve these healthier workplace environments, and some things that you can do to implement and take action here. So, and I'm really struggling with these slides today. I'm sorry. They seem to have a mind of their own and like move forward and then backwards. So we'll see where these puppies take me here. But as Robin noted, retention really is a key solution in the recruitment side of things, right? It's a whole lot easier to keep staff than it is to recruit, find them, hire them, train them, get all the background checks done. So what we really want to do is focus on retention and figure out how we can really support people in a way that's meaningful so that they can choose to stay employed with us, right? It also kind of gets to that career CNA piece. If we can really know them as an individual and support them in that way, it's a lot easier to choose to stay. So basically what I'm saying here is we need to use our emotional intelligence, right? That's a key piece here. That's our superpower. We know that our staff lead really complex lives, and there's a lot going on at home with their families, with their kids, with their homes and bills and all those things. And you need to know the individual to know how they need to be supported to stay. And there's research that supports this. The Annie E. Casey Foundation has done a lot in looking at how a stable home life compares to a stable work life. And you really can't be a stable employee if you have a lot of chaos going on at home. There is no wall of separation. You can't achieve that. So if you're chaotic at home, you're going to bring that to work. So I think there's a few questions that we can ask ourselves that are listed here on this slide. So looking at what is your organizational culture? What does it look like, not only from your perspective, but are your frontline staff experiencing and living the core values that your organization states that you have? Or do they have a different experience from what leadership would say? Looking at your frontline leaders, are they really practicing servant leadership? Meaning, do they see their primary role to be a leader for their team? Or do they see their primary role as management tactics, performing skills, checking things off lists? Because our leaders really need to be servant leaders. Their first job is to take care of their team. And we know that when the team is taken care of, they can easily do their job to take care of residents then. So I know this level of individualized support and individualized investment can seem almost impossible. But in reality, I think when it's done well, it's a way that you get time back. It's a way that work gets done well. And it really isn't supposed to be extra work. It's how you are engaging while you do the work. Engagement is the work. That is how we do things. And so when you engage, you're being proactive, you're finding stability, and hopefully you're solving the root of the issue rather than just putting Band-Aids on it and moving on with your tasks. So the question, of course, then is, how do we get there, right? So if we look at the big picture, and the LTSS Center is the research entity within Leading Age. So that's what Robin is co-director of. And we've done a lot of research in this area. And what we've found in looking at direct care workers or direct care professionals is that they want to be seen, they want to be heard, and they want to be valued. Those are the three most important things that we hear from staff. They want to be respected and appreciated. And that requires really deliberate and systemic approaches. We can't leave it up to chance. We can't leave it up to the individual personalities of the people in our leadership positions, because we're really setting up people to fail if that's the case. If they've got a checklist in front of them, they're going to check things off, and treating people nicely or having personal conversations is always going to fall to the bottom because they've got stuff to do. So we need to set up those systems to really support our leaders and help them find success. We've found further validation of this wanting to be seen and heard and valued through a research study we did called COVID-19 Stress Challenges and Job Resignation in Aging Services. That research really dug into the importance of communication. And what we found is that when there is really quality staff communication and support on the mental wellness side of our staff and wraparound services, that's when staff feel like they are supported. It mitigates stress and helps them do their jobs well. So again, our leaders are the most important factors here in creating that environment. And Robin alluded to the fact that a lot of our nurses, they're the most important leaders in the organization because they're overseeing our direct care providers, but they often aren't set up with leadership skills. And so what we've found is that when nurse leaders are trained really well in leadership and supporting their teams, that there are fewer resident falls, there's less restraint use, there's higher resident satisfaction, there's lower turnover. So there are quality issues that are also involved in good leadership. So quality leadership, better teams, better care, right? And we know that most of our RNs aren't getting this. In fact, 75% of them are not receiving supervisory training. And so what's challenging here is that nurses have received a lot of education in clinical care, and they've got a lot of things they have to do each day. They have to monitor and supervise care. They have to provide care. They have to conduct assessments. They have to meet with families. They have to administer medications, right? All of these things they have to do. So again, the leadership pieces usually fall to the bottom. And on top of that, because of the structure and the system we have in place in terms of delegating tasks, nurses can often feel personally threatened if a caregiver makes an error, right? Because that's done under my license, it's done under my delegation. And so there ends up being fear within that relationship. And fear never drives a healthy relationship. If that's the basis of it, it's not going to drive anything healthy. So we really need to look at how we can support our nurse leaders here. You can't blame them for leading in this way, but we can help support with better systems. So we've really, covered a lot about the importance of these systems. I want you to stop for a second before we get into some of the actual practices to just think through your organization's culture, because I want this in the back of your mind as we're talking through these resources. So I want you to think about, how would you describe what your culture is today? What the symptoms are, what the signs of that culture are, and what needs to change. I want you to think through a little bit who the change agents are, and with that, who are those formal leaders, but who are the informal leaders? Because those are the people that we work through to make change, right? We know who those informal leaders are on the floor, and they can either be your biggest detractor or your biggest promoter, right? So think through who those people are. How is resistance to change expressed? When you launch a new activity, a new initiative, whatever, what's the pushback look like? Because then you know what to anticipate. And then how are you even going to know if you're successful or if it's sustainable? So I'm giving just a second to let that sink in, let you think through a couple of those things first, and then we'll move on. And if you want to chat in, how you empower informal leaders within your organization, please respond to the group. I just put that question in the chat. All right. So now that you've had just a couple minutes to kind of think through what your organization culture is like now, kind of maybe an area for some opportunities for improvement that are on the tip of your tongue, let's talk about culture change then in terms of workforce, because the good news is that we've done this before. We've done huge culture change shifts before in terms of resident care, right? Because we moved from medical institutional model of care to person-centered care. And that seemed crazy and unattainable and overwhelming at first, decades ago when we first launched this, right? How on earth do you actually provide individualized care to hundreds of residents? It's not possible. Well, it is possible. And that's what we practice every day now. And we did that by having these good systems in place. So we implemented things like personal care plans, things like care conferences and interdisciplinary teams that looked at the whole person. We started documenting preferences, social histories, personal histories, work histories, and getting to know what an individual's goals, hobbies, things they do for pleasure, right? We started getting to know individuals. And then meeting and making sure, meeting on a regular basis and making sure that they are fulfilled and well from that whole person perspective. And so if you're kind of following along with me here, this is what we're talking about doing with our staff then too, right? Moving from this really medical model, this power and control model of you do what I say because I delegated it to you, to a model where we actually know our staff as individuals, where we have individual development plans, where we know their personal and social histories, where we know what their personal goals are, and we look at them as a whole person and how to help them attain those things. So there's a few ways to do this, and I think the best place to start is by looking at your core values, because your core values should be what drive everything you do in your organization. It's not a couple of words that sit on your website. It should really be integrated into your daily behaviors and actions. So looking at things like all of your meetings, all of your performance-based conversations, events, awards, recognition, big meetings, little meetings, care conferences, everything that you do, where do your core values fit in there? So a couple of things you can implement would be things like sharing mission moments. So this would be giving everyone an opportunity to go around the circle in the meeting or in the room and say, share a story from that day, that week, that month, whatever, of someone that they've seen living out the core values in your organization, because that can bring those words to life when you actually have an example or an experience of someone who's performing or behaving in that way. You can include shout outs in your meetings. So each person takes just a moment to quick thank a colleague who's helped them, right? Like, hey, I was double booked for meetings. Robin took a meeting for me, took it off my plate, was able to cover it for me, totally saved my life. Thank you so much, Robin. And that takes 10 seconds to do in a meeting. And it can really build that camaraderie. It can build those friendships and relationships, and can demonstrate through real action how people are supporting each other. And it helps build that environment then. You can do things like sharing your why, right? This is great for new employee orientation. This is great for large team meetings. So you can get to know why people work there. Why do they work in that role? Why do they work for your organization? Why is it meaningful to them? It helps you get to know people on a deeper level, and it spreads that positivity about our organizations. So there's a lot of ways to really build in your core values into your actions. And another way to live your core values is through games and activities. And I would bet if I had all the Brady Bunch people on my screen right now, I probably would have seen 98% of you roll your eyes, because everybody thinks they hate games and activities. But they're actually a really, really powerful learning opportunity, because games get people's attention, they get people to engage, they get people to connect. And when learning is fun, it can actually motivate people to change. So what I would encourage in the kind of game territory is that you really think through that assessment that I shared just a few slides back, and think about what your challenges are right now. Are people not being respectful to one another? Are they not listening to one another? Are they not friendly with each other? Is there a lot of backstabbing? Are they just really stressed and burnt out? Figure out what those issues are, and then find a game or activity that addresses that thing, right? So maybe survey walks in and everybody's like pulling their hair out because it's the last straw to have survey walk in today, right? So stress is like going crazy. Maybe that's an opportunity to do a meditation exercise for everyone at your morning meeting. Maybe there's a lot of backstabbing going on because the day shift is so freaking tired of the PM shift or the overnight shift, not emptying the garbages, And right, that kind of stuff happens all the time. So maybe there's relationship building activities you need to do during shift change, where there's getting to know you activities and you're just asking totally non-work related questions, but getting people to know each other on a personal level. What was your favorite song in high school? What would it be like if you heard it on the radio today? What was your favorite toy when you were a child, and where is that toy now? If an actor were going to play you in a movie, who would you choose, right? Those types of questions can seem silly, but it can spark a conversation between two people that brings you to that next level of friendship and camaraderie. So hopefully I made my case for games and activities, even though I know you think you hate them. Just try them. The next practice I want to quick touch on, and I know we're starting to get short on time here, but it's leadership rounding. And this is one thing when we talk to our direct caregivers, that is one of the most important things that they experience in their work. If the leaders do genuine relationship building, leadership rounding, they talk about it. It makes a huge difference to see people on the floor. And there's a couple of different things that you're looking to accomplish if you have really good leadership rounding in place. So one is to build relationships. It's for you as the leader to get out there and to get to know people on a personal level. So you're asking questions about how their weekend was, how their vacation was, how their kids are, how their new puppy's doing, right? It's non-work related questions because you just want to get to know the person and what their interests and hobbies are. Another key part of leadership rounding is to facilitate camaraderie. Because again, when we have really good teams that communicate well with each other and have good relationships, they always work better together. So it's your job as a leader to help kind of set the table for a way for them to become friends. One way to do that is when you're leadership rounding, actually asking people, who's helped you today? Has anyone really saved your butt today? Asking those types of questions. And then when you hear it, yeah, oh, Robin helped me this morning. There was this resident who needed XYZ and I couldn't get it on my own and I needed her help. Now you as the leader have just heard, okay, Robin did something really great today. So now when I see Robin a few minutes later down the hall, I can say, hey, Robin, come over here. I just heard something really great about you. Thank you so much for doing XYZ, helping Jenna with that one resident this morning. You totally saved her life. She was so appreciative. Now, Robin's glowing because her boss knows something really nice about her and that feels good. She's also feeling like, hey, that Jenna's a really awesome person because she's saying nice things about me behind my back. And it's those little behaviors that can help build camaraderie. There's also things you're doing when you're out on the floor, like gaining insight, just taking in what's going on the floor, how it feels, what it looks like, what the chaos level is, right? You're accountable. You're hearing things that need to be done. You're hearing ways that people need help, and you're doing something about it when you're on the floor. You're following through, following up, right? So leadership rounding is a really great way to be out there, be in front of people, be connecting with people. And while you're out there, you're living and demonstrating your core values, because that impacts culture when you demonstrate it and people can see leaders behaving in that way. And feel free to chat in if your organization does leadership rounding, because there's a lot of different ways it can be done and a lot of different little practices that can be put in place that are effective. And it would be great to hear what you all are doing in terms of leadership rounding, if you wouldn't mind sharing. Another really important practice that we hear from frontline staff is the importance of individual development plans. So this kind of goes back to that personal care plan comparison I made when we instituted person-centered care. This is person-centered care for our staff. So when we do individual development plans, looking at the whole person, what do they want in their life professionally? What do they want in their personal life? What are their goals? There's a book called Dream Manager that talks about how important it is to know someone's personal goals, because you as their supervisor, as their employer, can help them achieve those personal goals. So maybe their goal is for their oldest kid to be the first person in their family to go to college. So you as the employer, you're not necessarily going to pay for their kid to go to college or to tutor them themselves, right? But can you help them by setting them up with a financial advisor through your organization? Is there something through your EAP that might be able to help them with goal setting? Right? Those types of extra steps you can take to hook them up with the right resource really changes who you are as the employer in your staff members' minds. But it's also, as we talk about the fact that there's no career caregivers anymore, this is a way to help you find those people who are career caregivers or who could be, and how you can engage them to stay in that role. What are those things that they want to do to deepen their skill level and deepen their expertise? So my next slide gives a couple of hints there, because it doesn't always have to be a promotion, right? If frontline caregivers or culinary workers or housekeepers have an opportunity to attend a training or a conference that they wouldn't normally go to, or lead a meeting, maybe it's the caregiver who's leading morning huddle. Maybe it's a caregiver who's leading at shift change, right? Maybe they're participating in a committee or a special project or a task force. Maybe you're giving them the opportunity to job shadow the nursing home administrator. Or perhaps there's a sister site down the road and you can have them swap where they work, or job shadow at your sister organization for a morning. And they can pick up on best practices there and then bring them to your site and lead that change, right? There's a lot of ways that you can give responsibility, build skill, build confidence in your staff that can help them grow and feel like a really important part of your organization. And I'm going to just zoom along. So the last thing I want to touch on, and Robin, I think you want to jump in here too, is the importance of QI work within workforce. And one kind of spin I want to take on this is teaching frontline staff quality improvement models, because we've seen really, really cool things come from this. When you teach frontline caregivers, PDSA, for example, Plan, Do, Study, Act, right? We're probably all familiar with that in this crew. But letting them select, okay, what's my biggest challenge every day that I just run into all the time? And what's the solution to that? Because I know what it is. I'm the caregiver running into that problem all the time. If they're given the opportunity to collect data on what the issue is now, implement the solution, the idea that they have, track the data, see if it works or not, take another look at it, make any tweaks they need to, keep collecting data, present their findings to the group, they get to really become an expert in that area and contribute in a new way to your organization, in a new and important way. They feel really important when they solve a problem. They get to put the team together. And we've done this through a lot of organizations and with a lot of caregivers. And the confidence that comes from it is amazing. And on top of that, lots of things can get resolved without it ever being dropped on the HR director's desk, the DON's desk. They solve their own problems. And so I would highly encourage you to consider, as some of the intentional growth of your staff, teaching them PDSA models and letting them take on their own QI projects. And Robin, I think you have an example from Wellspring.
Yeah,
as well.
I just wanted to mention a number of years ago, my team evaluated an alliance of organizations out in Wisconsin called the Wellspring Quality Alliance. And basically, this was what it was all about. They were actually doing CQI around residents, but they built in the aides and frontline supervisors and RNs as teams. And not in addition to doing CQI around the residents, they were really doing CQI around the workplace. And the fact that the aides were included and were owning and actually leading some of these data teams around looking at what was going on in their organization, tying it to the outcomes of people who they were caring for, working together. This alliance used to take all of these teams out to weekend retreats. And I can't tell you what it was like to have to observe weekend retreats with aides, frontline nurses, and DON all at the same resort place. All the labels were taken off of their clothing. I mean, they were really in a total team environment of owning data, sharing data, and learning. And we analyzed quality outcomes. We also analyzed Medicaid cost reports for Wellspring for 2 years and found unbelievable outcomes on all three. So the truth of the matter is that not only was this an incredible qualitative process, but it also had a return on investment for the whole organization. And I think it really demonstrated the importance of, if you do these kinds of things in this way, you're actually not creating more work. This is the work that people are doing because it's built into their workflow every single day. And it's incredibly exciting.
Mm-hmm. Yeah, thanks, Robin. I think with that, just based on time, let's stop. Stop and open it up to conversation, or Kim, if there's a different direction we need to pivot to quick,
Yeah.
let's do that. But should we stop and open it up to questions or comments, or sharing what's going on in your organizations?
No, I love to continue this conversation. I got a little jump happy on my click here. So something came in, a survey came in. And yes, I do want everybody to do the survey, but I didn't mean to cut anybody off. That was not my intention. And I also have a source control document that I have to redo and put in there. But anyway, yes, I'm absolutely up for questions. I find that this is really the heart of everything when it comes to quality care for your residents, staff, leadership, and everyone. It's very overwhelming, though. I don't know if any of the participants feel that way, but I can remember sitting as a director of nursing, and you know that this is what I'm supposed to do. I know what you're saying. I get it, but I also have to write this report, and then I have to do that, and then I got to do this, and I got to do that, and it's overwhelming. With that being said, Jenna and Robin, do you have any advice on where to start, or what's my first good step to just maybe get the process started?
Well, I think Jenna said one thing. I think every organization needs to do an organizational assessment of these issues. I also think that it's really important to do, and you may all be doing this already, but interviewing people from different levels of staff in your organization, because you will find there's so much cognitive dissonance between what you think is happening and what others say is happening at a different level. And you've got to start by understanding that basic challenge of where are your disconnects. I don't really believe that there's a way to move forward without understanding that. And I'm sure there are going to be people on the Zoom call that have fabulous organizational cultures and really do this, but I can tell you we've worked with hundreds, probably thousands of organizations over many, many years. And there's a lot of disconnect because we don't, especially leaders, don't really understand what is going on at the different levels within their organization. Staff to staff, staff to resident, staff to staff in different levels. And I don't know, Jenna, whether you feel this way or not, but to me, you've got to have a really good basic understanding of the culture of your organization. And then there are lots of tools. We have many tools that we can share. I mean, none of this is rocket science. It does take time, but the more it's built into your work processes, the less it becomes an additional thing to do. And,
I think that's one of the key pieces, is that we're definitely not suggesting anyone implements a new program, right?
No.
Or a new initiative, or identify a champion to lead this new person-centered workplace. Like that never works, because it's tied to the person. That person leaves, or it drops to the bottom of their to-do list and nothing happens. I think the idea here is that any of these kind of systems or things that we talk about, that it gets built into your existing schedule. So if there are games or activities or conversations or things that need to happen, build it into that first 5 minutes of your stand-up agenda, or the first 3 minutes of your department meetings. When you do your staff satisfaction or engagement surveys and you get the results back, do you have, and you're coming up with the action plan of what you're going to do about it, do you have those frontline caregivers and housekeepers and everyone on the action planning committee?
Mm-hmm.
Because if it's just the leaders saying, oh, we got a bad score on communication again, we're going to make sure we have an extra newsletter put out, and we're going to make sure everyone has an email address. Well, that might not really cut it for your frontline staff. And so leadership thinks, well, we resolved that issue. And caregivers are saying on the next survey, communication still stinks, right? So making sure you have the right people in the meetings. But it's even things like, I have a meeting down the hall, and rather than leaving 30 seconds before the meeting starts, I'm going to leave 10 minutes before the meeting starts, so that I can slowly walk down. I can interact with people as I go. If someone stops me in the hall, I can actually stop and give them 3 minutes rather than saying, too busy, got to go to my next meeting. So I think there's a lot of just kind of agenda building in that you do throughout your day, rather than implementing a program. if that makes sense.
You know, Leading Age a number of years ago worked on a frontline nurse leadership supervisory training program called Nurse Lead. We actually have it at Leading Age on our website. And one of the things that struck me forever was seeing what a teachable moment means. And I think partly, Kim, it's having folks understand how you use, as Jenna was saying, how do you use your daily activities when there's a problem on the floor, instead of how do you use that as a teachable moment to turn it into something positive where you learn how to do something in a different way. That's completely built into your workflow. You don't need a new program to do it, but you've changed the whole dynamic of the organization. I really believe that some of this has to do, the work that really needs to be done in many ways is at the supervisor level, because the organizational leaders and the supervisors need to understand how to create this culture. And that's, we see often where it falls apart. So assessing the quality of your supervisors, maybe they need coaching. They need work in terms of how they work with this front line that is, again, 60 to 80% of the hands-on care. So that may be the input that needs to happen. That's a little bit more than your daily work. And then they start to build that culture that way, and it becomes just normal. It gets normalized.
Yeah, I love all of your examples. That's what I was looking for. And I wouldn't doubt maybe the participants were too. What are some few things I know I could do right now to make a difference? I mean, that's just the start, of course.
Yeah.
But yeah.
You can't, if anybody approaches this as an additional program, it's going to die. First of all, there's so much resistance, it will never go anywhere.
Right.
But it will also die as soon as the person who introduced it leaves or somebody else leaves. So it's definitely got to be something that everybody can live with. Otherwise, there's no reason to do it. But the data on the quantitative side are so strong. That supervisor is so key. That is the major reason that people leave leave these organizations. And it shows. Go ahead.
Real quick here. Do you, do you have a resource slide? Do you have a resource or where you think these participants would go to for like frontline supervisor training? Even though I see in chat, Christy put that Leading Age Minnesota has a grant program called ICANN, and this training is to drive quality from frontline through QI projects for nursing, for the nursing assistants to lead, which is so cool. But if there was any like particular nurse leadership supervising training that you suggest, or does Leading Age provide?
I just threw it in the chat. It was a slide I ended up skipping just for time, which is probably the wrong thing to have done, but it's called Nurse Lead. And I put the link in there. There's also Jerry Res, which I think is a really powerful, it kind of creates a residency program like you see in hospitals, but for LPNs and RNs in both nursing homes and assisted living. So they have curriculum for all of that.
Yeah, and Jerry Res is on the Leading Age Wisconsin website, at least on the Leading Age Wisconsin website. I just saw it actually the other day. I mean, there are many of these kinds of things. I would say my recommendation is always that at least try to use something that has some evidence base behind it. That's one of the things that we always do with the programs that we've developed, is we do a fairly rigorous evaluation. Is this really working? But there are tools out there, and certainly Leading Age has quite a few resources available. So
good. All right. Well, Jenna and Robin, I really appreciate both of you presenting on this topic. It is such a hot topic, trying to retain staff, to get staff, empower staff, motivate staff. So I really appreciate your time. Everyone, I would just like to remind you that there is an evaluation for today's event. There was a part here that we did not get to about source control and masking that we weren't able to share with you. That's okay. We can do that again. I was rather hear Jenna and Robin's presentation today, but I do want to share with you in chat. You'll see Superior Health has a source control masking document that I really encourage you to look over. It'll help guide you with when to wear a mask, source control, so on and so forth. So please look at that. Next time we meet is on July 26th. I think the timing's pretty darn good because our very own quality improvement advisor, Tracy Ratke, is going to be presenting on, guess what? Processing change. Can you see how this kind of goes together almost as a second step to this presentation? So again, please fill out the evaluation, use the source control document, look at those resources that Jenna and Robin have put into chat, and engage your staff. They really need it. And I hope to see all of you in 2 weeks for processing change. Thanks again, everyone. Have a really good rest of your day.